I've been coming to the Detroit Medical Center for 55 years. This is my hospital.
This is it, DMC, I don't go anywhere else.
The Center for Urologic Reconstruction is centered at the Detroit Medical Center. This is a multimodal treatment center for the problems faced by patients who have urologic reconstruction difficulties. We believe there's lots of benefits to the concept of a high-volume center. For starters, we have a wide degree of experience, and so therefore problems tend to not be mysterious for us because we've seen them before. Secondly, we've been able to develop what works for us with our patients, but also to go nationwide and worldwide and vacuum up the techniques that seem to work for other people as well and apply them to our patients. We also, by repetition, have all the processes down to the point where this is not so much a random custom job for each person, but the ability to sort of get it right over and over in a repetitive fashion for the patient.
Dr. Santucci, he's great. I mean, the way he treats me and what he did for me, excellent. He really stays with you until you're really on your own.
I feel like he could be my son. He really, Dr. Santucci is a wonder. You know, he's amazing. My diagnosis was kind of grave. It was really grave. I was diagnosed with kidney cancer. The right kidney was masked completely. The left kidney had begun to mask.
We had an aha moment with Annette Jones-Daniels because we realized that we could take our skill set in reconstruction, apply it in a kidney cancer surgery, and convert her operation from a definite 2 nephrectomies have to be on dialysis to 1 nephrectomy with 1 delicate complex surgery that saved the other kidney and got good cancer control.
His work speaks for himself, and I'm a living witness, sitting here, no pain, no problems, just living my life.
I would have to self-catheterize once a week, about 1.5 years, maybe 2 years. One Sunday, couldn't do it. So I went and saw Dr. Santucci, and he said, it's time for a urethroplasty. And I said, what? You know.
Michael had a difficult problem. He had a fairly significant urethral stricture. He was looking at a problem that was bothering him every day of his life. And so it's particularly gratifying to be able to provide a 3-hour operation to Michael and get him cured for life.
Now, I mean, I don't even think about it. I mean, because it's done. You know, it's over with, and I don't have a problem here. Thanks to Dr. Santucci.
We have a plethora of cases, everything from the top of the urinary tract down to the bottom of the urinary tract, to be able to reconstruct on patients that elsewhere wouldn't be able to get that treatment.
Buried penis is a sort of strange and, I think for some people, titillating concept, but these patients are truly miserable. And it's a good example of where there was no home for these patients. There was no place for them to go. We developed an initial cadre years ago of 6 patients. We actually developed some rules and ideas about how best to treat them. And at that point, we realized this was really the only recent paper on the subject in a long time, and patients started coming from all over the country to get this taken care of because they simply couldn't get the care locally. I believe that the next important component is benchtop to bedside research. So we work with several different companies as their clinical arm to evaluate new technologies, always trying to move that ball downfield. We also have some important, I think, clinical collaborations. We've been working with the Marine Corps as part of their Dismounted Complex Blast Injuries Task Force to try and optimize treatment for the gravely wounded soldier, often who's injured by an IED that's on the ground and suffers limb and often genital injuries. And I think the final part of a Center for Urologic Reconstruction is that we train others.
My role here is to learn how to both diagnose and treat surgical reconstructive urologic issues, as well as be able to learn how to educate residents You can't have great research and great cases if you don't have the patient numbers that come in. With Dr. Santucci and Detroit Medical Center, we're able to attract these patients, and with that we're able to build up our caseloads to be able to do research on different types of reconstruction, urethroplasties, research on trauma patients, as well as the neurologic patients.
Our goal is to have lots of centers of urologic reconstruction. We believe that America's underserved in this regard. We're committed to continuous improvement, and we're not going to quit until we get there.